directly invite you to give a speech. Please.
Thank you very much, Madam, for kind words. Thank you, IMS West Zone Conference, for giving me opportunity to share my views on this particular topic of sexuality and menopause. This is my credentials, Madam. I urge everybody to become a part of ORCID. It is a very good site in which you can have all your registration number and that. I am okay. So thank you very much. Recently I got 2 seats of DNB, and in first round, Ashwin, 2 students had joined from All India quota. So thank you. Previously we are running CPS courses, and now it is there. The moment child is born, mother is also born. She is there. Mother is something new, said by Ranveer. With the blessings of mother of mine, 3 books written by me is recommended in Royal College as a reading material. Atlas of Fetal Echocardiography and Technique of IVF made easy, gone for second edition, and I am editor-in-chief of 2 journals. Those who want to publish their paper and their work, they can contact me anytime. And recently I got opportunity to take interview of Professor Herman Turne in Denmark, Ashwin. You can see this video on YouTube channel Manish 4269. My presentation is divided in this 5 parts. Within this 15 minutes, I would like to give you insight about what is sexuality and what is menopause. Menopause, it is moon at pause, no man oppose, all senses at pause, and causing mood swings, hot flush, disturbances. On sexual ground, you can say there is loss of libido, dyspareunia, vaginal dryness, and laxity in vagina. We all know that during menopause, a woman's body undergoes significant hormonal changes. Ovaries stop producing eggs, and the level of estrogen and progesterone stops. This is very unfortunate history of menopause. If you see, historical medicine defined menopause as a deformed male who after menopause finally become more like a man idol. In 1710, menopause defined as a disease and the worst calamities of beset the female sex. Freud has mentioned that male-dominant theory of human development. Believe me, in 1800, there is treatment and cure for menopause. They are giving leeches on the genitalias and cervix, cold water to the abdomen, arsenic, sitting in hot room for sweat more, and to dilate your from say play gold. This is the only activity which can give you 6 to 8 hours of play. Why this is there? Because there are so many symptoms in menopause. 34 symptoms are already designed in menopause, but today my talk is pertaining to loss of libido and discomfort on intercourse, that is 48%. Some common sexual changes are occurred during menopause because of vaginal dryness, decreased libido, and pain during intercourse. And these changes can be frustrating and even painful for many women. But it is important to remember that they are normal part of aging process. In India, we don't have that much of menopausal problem. Single reason is we are not nuclear family. We are Sayukta family. Things which is pursued by mother-in-law, pursued by mother-in-law's mother-in-law. So they will say these all are the natural changes and this you have to suffer. And that perimenopausal age and menopausal age is very well curtailed in our social stigma or social domain that we don't have that much of menopausal problem in our society. There are so many changes. It is not on men, it is man and woman both. There are differences in sleep pattern, metabolism, cessation of menses, one mood, sense of well-being, body image, self-esteem, everything will go. In clinical trial, they said that testosterone was found to improve. Because if you see the old definition, they say it is a male line. So now, you have, as a woman, you have to use the hormone which is good for men. So that is a testosterone is helpful, but it has got some improvement in the sexual life, but feeling of pleasure will not be there. You all know that all these things are because of estrogen and progesterone. Believe me, actually, there are more than 400 functions of estrogen and progesterone in our body. Most common is vulvovaginal atrophy. Approximately 64 million women in US are in menopause. Half suffer with pain during cares. There is dyspareunia, and this is dyspareunia because of chronic progressive continuation without treatment. If you do the patient survey, then more than 4% women attribute to their vaginal symptoms to the vulvovaginal atrophy. And studies show that more than 70% of women do not bring up their atrophy symptoms to their healthcare provider. and I will show that there are very good treatment by laser of this vulvovaginal electrode. Because ultimately we have to give very good health to vagina. For that, estronization is the vaginal tissue, estrogen is there, and because of estrogen there is very rich in glycogen. Glycogen is substrates of lactobacillus, which convert glucose into lactic acid. And recently in Ashray we have discussed a lot about microbiota. For healthy vagina, we must require lactobacillus in our food. In India, this problem doesn't happen because every day we are taking buttermilk and curd and ghee in our diet, and that is very good at lactobacillus. Otherwise, you have to take good healthy lactobacillus from healthy vagina and put into your vagina. And this is the recent development for increasing vaginal milieu as a microbiota to prevent recurrent pregnancy loss. Man is also suffering from menopause, andropause. It is a cognitive decline. There is prevalence of clinical depression increases, but most of the time it is underdiagnosed or under research. Erectile dysfunction increases from age of 50 to 80, from 5 to 50%. This is because of androgen loss and typically vascular tissue. If you start the age at 40, muscle mass declines and fat mass increases. If you give testosterone therapy, they are too precocious because of prostatic cancer and suicide. Why these things has happened? Because life expectancy at the age of 41, it is 1009. In 2023, life expectancy is 85 years. So we have to give them very good quality life. And very good quality life, sexuality is one of the part of quality life for man and woman both. So we have to present the concern when there is a low desire, pain disorder, pleasure and arousal. For that we have to give a team approach. Gynecological obstetric care, sexual health medicine, psychochromotherapy, physical therapy, physiological therapy, psychotherapy, and we must engage dietitian and massage therapy because this whole our patient is little bit obese because fat mass is increasing and muscle mass is increasing. General approach, first we have to take history. History is very good definition in history. History study of past in light of present to a good future. Give the years, listen them carefully. Listen and carefully design what is their sex relation therapy. Slowly and completely ask every psychological point. Always work for grief work, focus on resilience, address anxiety first, and always put interventional or evidence. Let them talk about sex when there is a sex session or when you have 3-4 patients of your in which you want to take menopause therapy. Just give them interaction, what they are doing, and always give them basic self-care and stress management. Complete history, and we have to see, check for assumptions like assumed heterosexuality. We have to see that their pursuit of excitement has not changed during these years. So we have to see for heterosexuality, assume monogamy. This is also increasing celibacy in single women and importance of sexuality, particularly begins. And I would like all this short word of menopausal therapy, and we have always, all the patients, if you do education, including terminology, anatomy and specific sex education, and remember that nobody wants to see them as dumb about sex. Everybody knows everything about sex, and this is the only subject in which there is no tuition class. If there is there, actually we would like to enroll our name in this tuition class of sex therapy. But everybody knows everything regarding the sex therapy. And this is because of low libido, and patient has got vaginal discomfort, feeling low, feeling tired, relationship difficulties, not feeling well or emotionally stressed. And there are lots of medical management. We have to improve the vaginal health by moisturizer, lubricant and intimacy. We can use HRT like Tibolol, it improves libido, helps in one process, promotes bone strength, but not suitable for more than 60 years of age. There are small risk of increasing endometrial cancer. Testosterone, again there is a male hormone, male human like in 17,000. Very effective for low libido, needs blood test before starting. We have to use this as a potential side effect because of acne, hair growth and irritability, and one study says there is little bit increase in the breast cancer. Always talk on relationship counseling or psychotherapy consult, and we have to work on all this exposure from body image to mental health. There are few different very good discrepancies. One is desire. What she says, I feel like I could live the rest of my days without ever having sex again. but my partner feels frustrated and I don't love him anymore. How do I make myself want to have sex again? This comes in desire discrepancy and doesn't cause distress, that is HSDD, hypoactive sexual disorder deficiency. All these small forms are very good. In men, one of the most common causes of sexual activity cessation is loss of erectile function, which can look like loss of desire to a partner who is adult. For that, we have to give a very good dual control method in which there is inhibition and excitation. We have to work on psychological and organic issues on both the sides. This is very good pain disorder, genitopelvic pain and penetration disorder, that is GPPPD. Down there has always hurt. Temples, everything. I want to have satisfying sex life, but I tense up anytime my partner comes too near this area. We always explain them, just relax, do it more often, but when it's getting more better, but it is always causing pain. This is because of vaginismus, dyspareunia, because of atrophy, overactive pelvic bone and vestibular diarrhea. Pleasure, my sex life is not exciting. Orgasm is intense or even exists in most cases. I had just really rather not. I do it mainly for my partner, but even they are noticing and they are upsetting to them. That this is because of an organism, that is the primary versus. Who is getting the entitled pleasure? Is male or female? I think it is both, but usually expression is done by male only. So we have to take this, for this I will take only 15 minutes, but I don't discuss this because this is very good chart of Besson non-linear model. If you go through this model, you can have a very good discussion with your patients that what you are suffering, and always communicate with your partner. Partners should be aware of changes that menopause can bring and should create an environment where both individuals can express their need, concern and desire. Understanding of these changes are a natural part of life and not a reflection of diminished attraction can help to maintain emotional intimacy. Exploring new avenues of pleasure. Menopause can bring you an opportunity for individuals to explore new experiences, engaging in extended foreplay, incorporating sexual activities and focusing on emotional connection can enhance the sexuality. Communication about preference, experimentation and maintaining an open-minded attitude can lead to discovery of new sources of pleasure and intimacy. Always take self-care and life changes like prioritizing your self-care, regular exercise, limiting alcohol consumption and evidence of smoking. Always do very good care of physically and health care, always take very good diet. Now for typical therapy. This is magnetosteam, pelvic floor dysfunction treatment, that is the magnetic chair. So just sit over it, there are different modes and this will give you pelvic floor muscle stimulation. It is just like Kegel exercise and it will strengthen your pelvic floor muscle. We can use non-invasive laser vaginal treatment for weak hair. This is our center in Indore and there is different modes of Intilase, Intimalaise and Inovolase. Intercourse laser, we have got 51 patients and with 3 sitting, there is very good betterment in the treatment of SUI. Even we are giving urethral laser to all these patients and believe me, 98% satisfaction rate is there. And this is RBM laser in SUI. After 3 visits, all the patients are satisfied on King's Course of questionnaires. Global days, we have got 15 patients and on 3 sittings, there are 70% satisfaction. On GSM, that is genital symptom of menopause. All patients are found very good activity after 3 sittings of laser short treatment of RBM laser, and recently we are publishing this paper on it. And we have got 13 patients of Intimalaise, 90% satisfaction is there. So this is one of the treatment for vaginal ectopic. As lactobacillus is also increasing your vaginal glycogen, likewise laser is also increasing your glycogen content. It will decrease the laxity, it will increase the sexual activity because of there is rugosity in vagina will become very tight, and SUI is less because it's distressing symptom for female. And with this laser treatment, there is atrophy is also gone and SUI is also benefited 98%. There is mild to moderate stress urinary incontinence, and this is our paper published on non-ablative RBM tag laser treatment for stress urinary incontinence. We had done this study on 78 patients. We can use always so many different things, like tender loving care of vagina. Moisturize vagina regularly every 2 to 3 days in evening or after bath. Use lubricants for intercourse. Don't forget estrogen is missing, so estrogen is needed. Topical estrogen therapy improves tissue moisturizer, reduce itch and burning, intercourse more comfortable, reduce recurrent urinary tract infection, helps significantly with some forms of incontinence. And additional point, minimally absorbed into the body because we are putting it locally. No progesterone needed, can be used lifelong, can be used if has past history of breast cancer, can be used alongside of full HRT, and pelvic floor exercises also needed, and these all are different kinds of lubricant. Menopause is natural phase in woman's life that can bring about various changes in sexual health and well-being. While challenging like decreased libido, vaginal discomfort and mood fluctuation may arise, this may be managed through an open communication, medical intervention, diet adjustment, psychological support and laser. It is crucial for women to prioritize their sexual health, exploring strategies that allows them to maintain a fulfilling and satisfying sexual life during and after menopause. Final tips, you don't have to know all because patient says they are knowing everything. Use inclusive language, spouse, partner. Normalize the talk. Many people experience this because you are talking with a delicate subject, because sexuality in India is not for you. Even in childhood or in adolescence or in menopause, you have to be very careful. Maintain list of specific information like lubricants and sexual health. Encourage the use word like not sex, use sexual health. Assume that person needs to know as perhaps you already know. If you say you are knowing this, they will say yes, we know this. So my genitalias do not tell you what I want or like I do. For men needs these difficulties because they are necessary to enjoy success, and this is said by A.P.J. Abdul Kalam. And madam, I have got the same award of Dynamic Indian of Millennium with Professor A.P.J. Abdul Kalam, and that was the best moment in my life. Recently, every company has marketing dydrogesterone. Now you see more than 48 companies are there with dydrogesterone, and they are making PPT with my name, and this is last audio. So at the end, everybody should be happy. Voice. તમારું ઓડિયો નથી લગાવ્યું છે ઓલરેડી લગાવ્યું. મારું તો બધું પાકું કામ કર્યું રાજા, મારો ધંધો જ આ છે. Yes. The life to be happy is now, and the place to be happy is here. And the way to be happy is to make someone happy and have a little heaven right. Recently, this Maharaj is passed away, but he is very good in singing and taking these small notions. Thank you very much. Thank you again, IMS, for giving me opportunity to start with the things which usually start in night and they are given in the morning. So thank you. In morning I discussed sexuality and menopause. Any question, most welcome. Thank you, madam.
Thank you, sir.
Please, you can get the answers. And sexuality, I already told that everybody knows everything.
That is, we have to give a receptive ear to each and every patient.
Thank you, madam. Thank you.
Thank you,
Very
sir.
much. Thank you.
Thank you for your elaborate talk. We will move on for the